How to improve inhaler technique for young children. Imagine trying to blow out a candle with a tiny straw. It can be tricky, right? Helping young children use inhalers correctly is just like that. Proper inhaler use is vital for managing respiratory conditions like asthma, ensuring the medication reaches the lungs effectively. When children use inhalers the right way, they breathe easier, have fewer attacks, and experience fewer side effects. So, how can caregivers and healthcare providers help children master this skill? One of the most effective tools is a spacer device with a mask. These devices act like a bridge between the inhaler and the child's mouth and nose. For children under 5, a spacer with a mask is especially helpful because it makes inhaling medication easier and more coordinated. The mask should fit snugly over the child's face to prevent medication from escaping. After attaching the inhaler to the spacer, encourage the child to take slow, deep breaths several times. This helps ensure the medicine is inhaled properly into the lungs. Hands-on teaching is also essential. Healthcare providers should demonstrate exactly how to use the inhaler and spacer, showing each step clearly. Then, they should ask the child or caregiver to repeat the process, a method called teach-back. This cycle continues until the technique is correct. Repeated practice helps children learn and retain the proper steps, reducing mistakes. Studies show that this approach improves technique and decreases misuse, especially in children aged 8 to 14, but it is also very effective for younger kids with caregiver help. Teaching should be tailored to the child's age and development. For very young children, caregivers need to be trained to assist with inhaler use. For older children, engaging tools like videos or interactive games can make learning fun and memorable. Healthcare providers should offer personalized instruction at every visit, including when new inhalers or spacers are prescribed. Regular monitoring and reinforcement are key. Parents, teachers, and caregivers should observe how children use their inhalers regularly. Technique should be checked during medical visits and whenever new devices are introduced. Proper cleaning and storage of inhalers and spacers also help keep them working well. Visual aids like simple videos showing correct inhaler use can be watched multiple times. These videos help children and caregivers remember the proper steps and build confidence. Teaching children to breathe out fully before inhaling, then taking a slow, deep breath through the mouth or mask, and holding their breath for about 10 seconds allows the medicine to settle in the lungs. Since children use inhalers in different settings, at home, school, or clinics, consistent education across all environments is important. Reinforcing proper technique everywhere helps children develop good habits and manage their respiratory health effectively. By combining these strategies, using spacers, providing hands-on and repeated instruction tailored to the child's age, regularly checking technique, and supporting children across all settings, we can help young children improve their inhaler use. This leads to better control of asthma and other respiratory conditions, helping children breathe easier and stay healthier. Always remember to consult healthcare professionals for personalized advice and guidance tailored to each child's needs.